Okay, we're going to continue from here from our CDC Health Disparities Report and go into some of the terms that we've thrown around a lot of terms already, even in these first 20 minutes. So let's talk about what we mean by them. Dr. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." It's quite the big statement. Let's unpack that a little bit. So inequality versus inequity. What is the difference? An inequality is when two things are compared and they're not equal. So a simple difference in value. And inequity implies that when these two things are compared, we determine they should be equal. So inequities are often labeled as an injustice. There's something not right, not fair. There's this justice factor that is inherent in the difference of the two numbers. So for example, let's throw this out there because, well, I say justice is fairly relative in how it's practiced around the world. It's different in different places. And with that come questions of what are rights. So in this graph we see percentages of populations without insurance by race or ethnic group. Now this slide says race, but really some of these are ethnic groups as well. And we see Latinos on the far left with 41.6% without insurance. And on the far right, we have Asians and whites around 14%. So is this an inequality? Well, absolutely. There's a difference in the numbers. Is this an inequity? Well, that depends. Do you consider health care a right? And that has been an ongoing issue in the United States. Let's talk about equity. What do we mean by equity? So a standard definition you can get online is according to natural law or right, specifically freedom from bias or favoritism. So that word natural in there implies that it's the way things would be naturally, that's the right way to do things, and specifically it has to relate to biases that have been introduced over time that have led to different outcomes. So when we say that something is equitable, we're talking about that it's fair, impartial. And with this, this comes from this idea that naturally things should be fair. They should be equal between people. Things should be fair. So other synonyms for equity are justice, fairness, justness, and impartiality. So that's equity. What is health equity? Health equity then looks at the absence of systematic disparities in health or in the major social determinants of health between groups with different social advantage and disadvantage. For example, wealth, power, prestige. So this is one definition given out by Braveman and Gruskin. You have this article in your reading. So what this one is saying is that the systematic disparities, the injustices in the system are absent, that we equalize those so that everybody has the equal opportunity of health. And that's what they really get at in that second part there when they're saying the determinants of health have been kind of leveled so that there aren't these factors that are affecting negatively one group more than another. So health equity, another way of saying it, is that it means we achieve equality or fairness and justice between groups and that our systems or institutions are fair and just. Well, that's certainly a goal. I think we all have that goal generally across the board, but we do see disparities in the U.S. So in public health, we embrace the ideal of health equity as a premise and guiding principle for our profession, that we want to kind of level the playing field for everyone so that everyone has an equal opportunity at health. So working toward health equity, it's an intentional act of correcting our institutions. So we see in this very definition or approach that that there are things that have gone wrong down the over time, and we recognize that things aren't completely fair, that groups don't have equal access in one way or another, and we want to correct those. So we want to correct our institutions, specifically around those intentionally or unintentionally excluded by income, education, access to knowledge, racism, or discrimination, and that can be around gender, lifestyle, skin color, things like that. So we want to correct both the intentional and the unintentional exclusions of groups. But it also has to do with those who are not able to help themselves. So we recognize and we try to help champion the fact that there are groups in any community that need extra help. So whether this is looking after the rights of infants and children, and even the unborn is often an area where this becomes a hot topic, but then the mentally ill or those with other limits or barriers placed on them, those with mental handicaps, those with physical handicaps, maybe they're not as able to access healthcare or to pursue health. The third one is that those who we want to correct, we want to bring health equity for those who have been historically excluded. So we want to correct systems and situations to redress historic injustice. Obviously, this is a big issue in the United States. Really, over the past 40 years, we've seen the biggest 60 years, how long has it been? We've seen the biggest progress, but countries around the world are facing this issue. And those to whom barriers diminish access. So this is simply saying nobody meant to exclude these groups, but let's say our healthcare system in our nation as it is, we usually speak in English, and it comes from this Western medical system as far as belief system, value system, and this is very different for a lot of groups in the United States. So there's these cultural boundaries, and there's boundaries of literacy, or just physical boundaries, people who live in remote rural locations and have less access. So these barriers come up over time as new population groups immigrate, or they grow, or they move, and so we find new groups facing barriers to access, and so we want to address those as well. So that was inequity and inequality, and then what's this word disparity? So health disparities really is synonymous with health inequalities. It's meant to be simply that there is a difference. So it's saying that there is not equality between these two groups, so without parity. Disparity means without parity. So there's not other ways of saying it. There was that without symmetry, without equalization. So health disparities is literally unequal health. So this is the inequality. And the U.S. has taken a very careful road to stick to the term health disparity because there isn't quite that moral punch of it's an inequality. It's an inequity, excuse me. In Europe, you will often hear studies done around health inequities. They're more likely to put the moral stance behind it. But is every issue a health equity issue versus just a health inequality issue? Let's look at those. So sometimes there are naturally occurring differences. Some examples of that is rates of cancer or disease between men and women, because we have different organs, there's different diseases that can affect us. And so to have differences in those rates is simply a disparity or an inequality. There's just a difference in those numbers. And it's also rates of cancer disease that are genetically inherited, or longevity genes. These are things that are typically seen as genetically based, and therefore just there's nothing the system can do about it, in a sense. It's just a difference in numbers. And this can be debated because of the role of epigenetics and how populations and communities and their genes have changed over time due to the environment that they were in, due to the nutrition that was available to them. So even that last part I would kind of disagree with, but it's within the argument, it's thrown out there that there's, there's genetic differences that we can't do anything about. And some would stress that it is the greatest cause for most of our health outcomes, but really it's a very small part. So over time, as different factors within health become hot topics, different things will be researched and stressed, and right now we really are looking more at the broader system, that it's a multifactorial, multi-level approach to address health disparities, as we looked at with the environment, with the social, as well as the individual. But overall, we say when health outcomes are different between groups and the genetic factors cannot reasonably explain these differences, then we would say we're in the realm of health disparities. To give you some more background on the argument why in public health we even pursue health equity is because of this key question: is health a fundamental human right? In the U.S., some people say, yes, health is a right, and we base this on the Constitution, the right to life, liberty, and the pursuit of happiness. So the right to life, they equate to the right to health. But technically, you could define that differently and say, no, health is not a right. In Europe, however, across the board, they would say, yes, health is a right guaranteed by the state. And that's why many European countries have full access to healthcare insurance across the board for their population. So the next question, though, is access to health care a right or a privilege? In the U.S., this is less agreed upon. The key issue here is, can you have health without access to health care? That is a good question. And secondarily, do you earn access through working, or should it be given to you as a right? Is it contingent upon your actions, or is it something the state should guarantee to every person? So again, this is where Europeans would say, yes, health is a fundamental right guaranteed by the state through the provision of health care. It's the state's responsibility to provide health care for all of its population. But how we earn that and where you fall on the argument really depends. So it depends on whether you feel health and the pursuit of health care, access to health care, as a fundamental human right, or even if it's not a fundamental human right, but a right within the United States based on our Constitution. So the human rights that I was alluding to, this is where internationally this has become a big issue as we provide humanitarian assistance or aid, nation to nation. And as the UN tries to help guide that process, the question always came up: what are the basic human rights? What should be guaranteed to each person, no matter where they come from or where they are currently living, their gender, what nationality they have or they're claimed, their ethnic origin, their color, religion, language, any other status. So we're saying that there are human rights that are equally entitled, that we're all equally entitled to without discrimination. We're saying that there are rights that we are equally entitled to simply by being a human being, and we have those rights, and they should be free from discrimination. And so there are laws, there are treaties, there's international law that govern these. So the UN Declaration of Human Rights is something that obliges governments to act in a certain way or to refrain from certain acts in order to protect those rights, to promote the health and protect the human rights of the individuals or groups, either that belong to them or are living within their borders, or maybe of groups outside their borders but that they're affecting. But unfortunately, they're only enforced by governments who agree to them. It's not binding, but it's meant to be a guiding principle, and we use international policy, in a sense, international relations, between nations, that nations won't trade, they won't work, they won't cooperate with other countries who don't abide by these laws. So there are ways to help enforce it, but it is not universally enforced by any means. Again, the question, are human rights really universal, even though the UN has set these definitions and most of the countries around the world have agreed to them? Is it really universal? So a question I have: how would you define right to health if you were, first, a Somali woman, a British man, a child in India, a single mother in the United States, or a young adult in China? So we see that our concept of health, of rights, of what we're entitled to is very much shaped by our culture. So to help unite all of these different perspectives, the UN has published its Declaration of Universal Human Rights, and Article 25 specifically says, everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his control. So that is quite the list, and well beyond what many, many countries are providing for their population. But this is what the UN has declared are universal human rights. The second one, Part 2, specifically looks at motherhood and childhood are entitled to special care and assistance. So all children, whether born in or out of wedlock, shall enjoy the same social protection. This is another one of the standards that the UN has declared to help bring all countries onto the same level. What we see from this article is that many of these have to do with social determinants of health, that the social systems set up in place, whether it's providing food, providing housing, medical care, these social services, if they're essentially right, then that's something that's not just a business, it's not just a nonprofit, it's something the government is supposed to be involved in, is what this is saying, to help equal and assure the provision of these things for each person and assure that it's equal. So in the United States, as we said, within the Declaration, it states, "We hold these truths to be self-evident that all men are created equal, that they are endowed by their Creator certain unalienable rights, that among these are life, liberty, and the pursuit of happiness." So we're going to look at how we pursue this, how we live this out in the United States. And we're going to start with a bit of a historical perspective, looking at what this looked like 100 years ago or more, and I'll continue that in the next section.